So our last patient, and this is really an extension of some of the discussion on the previous patient, is a 50-year-old woman who's come in, and in fact she's come in with symptoms that are suggestive of menopause. So she's getting hot flashes, she's having mood swings, she is having sleep disturbances, she's finding that she's very fatigued. Again, it's very important to take a complete history. And in taking a complete history, the reason we're doing it is because we want to make sure that we're not just saying, ah, well, it's menopause. There are many other conditions, hypothyroidism, depression, that can mimic some of the signs and symptoms of menopause. So it's very important to get a sense of when are you getting the hot flashes, very important to understand what you mean by fatigue. You know, do you get up in the morning and you feel like you haven't slept? Very important to get an understanding of what the sleep pattern is. Are you having trouble falling asleep? Are you staying asleep? Is there a problem, for example, with sleep apnea? So you don't want to try and find a simple explanation for a complex number of symptoms if perhaps there may be some other reason for it. In this particular case, we do a complete physical again, investigations, which would include things like, I mean, she's fatigued, I would do hemoglobin, I would do B12, I'd do folate, I'd do ferritin levels, I would do thyroid levels to make sure that she's not hypothyroid. So there'd be quite a gamut of things that I would cover. And then after that, and I also would check hormone levels. We talked about FSH and LH. The history, as Alvin had mentioned, is very important in terms of a true definition of what menopause is. But I would do hormone levels to see what they're at, check the FSH, LH, the estrogen levels. And then I would proceed to talk about what I think the problem is. If it's obvious, if it's hypothyroid, thyroid medication. If it's depression, I would deal with depression. And then if I feel it's menopause, I would deal either with individual symptoms or the multiplicity of symptoms, and I'll pass it on to Alvin.
One of the things that we wanted to show you is how to treat some symptoms without drugs. And so, of course, all these symptomatology, as you see up here, can be treated with drugs. You can give a sleeping pill if someone can't sleep. But wouldn't it be nicer to give what the body is looking for? In my particular practice, most patients are looking for natural progesterone to help them sleep. Yoels just mentioned, for example, depression. Very often people will bring their mom in and say, Mom's depressed. Could you give her some hormones? You know, Mom gets into the office. She tells me the kids sold her house. They don't visit her anymore. She lives in an apartment by herself, and I'm depressed after I finish taking the history. So it doesn't mean that menopause is a cause of depression. So, for example, a patient who felt that they were feeling sad, of course you would listen to them, maybe make a referral to a psychologist, a psychotherapist, listen to them yourself, and most often I use 5-HTP. 5-HTP is a precursor to serotonin. Serotonin is the mood elevator, so instead of giving someone Prozac or one of the antidepressants, I would tend to give them 5-HTP. Now if someone came to me and said, Dr. Pettle, how can I get off my synthetic antidepressants? I feel I'm gaining weight on it, I want to get off it. I would suggest the following if you are on antidepressants. I mean, always check with your doctors first, but I would tell them that to alter their one day use the drug and one day use the natural. Maybe use 5-HTP 50 to 100 milligrams a couple times, maybe 2-3 times a day with water in the daytime so it won't make you sleepy. And at nighttime use it with a little bit of carbohydrates, and then it would help you go to sleep actually. So that's one of the treatments I use for a little bit of tryptophan to help people sleep at night along with melatonin. And I tell them to use a little bit of carbohydrates to help release the insulin, which would cross the blood-brain barrier and drag the 5-HTP into the brain and make the patient sleepy. So you can help put the person to sleep. Melatonin, an excellent way of getting a good night's sleep. It also prevents breast cancer. Melatonin attaches to receptors that are looking for estrogen while you're sleeping. Lowered sex drive, you can use aphrodisiacs. We talk about testosterone creams. We use a testosterone cream, a progesterone cream. But having proper lubrication in the vagina, some of the phytoestrogens phytoestrogens, the black cohosh, the dong quai, will help to balance off the hormones. One of the things I use in my practice is more of a balancing act. I see which hormones are out of proportion, which are high, and I try and give them a supplement or a natural means of lowering it, or I'll talk about nutritional means of lowering it. Very often in menopause, some of these things can be treated very nicely with natural substances. Hot flashes, black cohosh has tremendous research on it, and we have a lot of research on the menopausal supplements that we use as well in FemMed. But it's one of the things that can stop your hot flashes, and if you can stop your hot flashes without drugs, then you're way ahead of taking synthetic drugs. And most patients who come to the office have tried to use natural supplements first. I think that fatigue, thyroid, 1/3 of the people in this room are hypothyroid, and your tests are coming back normal. We now have implemented, Dr. Roz is in the office, we've implemented reflex testing for thyroid. Roz is right here. We now do a special test with a computer on tendon reflexes to see whether or not the patient's thyroid is subclinical hypothyroid. Even though the TSH might appear normal, we have patients who now appear to both of us. We obviously know that they're hypothyroid, but their blood tests say the TSH is normal. Well, TSH being normal, you know the standard deviation, only 4 people out of 100 will be outside the standard deviation. So a person gives you all the symptoms of hypothyroid. Giving them something to boost up their thyroid makes a lot of sense. You know, we give them the iodine tyrosine. Anything you want to say about some of these symptoms here? You want to have a look at that? I'll keep going. Hair loss, I use saw palmetto for that. Blocking DHT, I'll even measure the blood level of DHT if a person's got an overactive adrenal. Sometimes people get terrible flushes if their adrenals are tired. Very important. If your adrenals are very healthy, if you do a lot of meditation and a lot of spiritual health, people don't seem to suffer as much menopausal flushing as the people who have fatigued adrenals, because the adrenals are a backup for the ovaries. They are a backup for the ovaries when you're pregnant. They produce certain hormones, and when you're in menopause, they have the ability to make all the hormones to secrete as well the testosterone, and testosterone has the ability to make estrogen. So having, even giving a supplementation for your adrenals is very, rhodiola, for example, is a very good supplement for your adrenals. Or we now have the ability to write a prescription for DHEA in Canada. Years ago, we had to go across the border. Can't tell you how important it is to have fiber for bowel cancer prevention, for breast cancer prevention. We talk about carbohydrates. I recently diabetic. It was my diagnosis recently, and so I lost 35 pounds just by stopping the bread and the rice and the pasta, and more of a protein-based diet. But it fell off of me, literally. I think men lose weight a little quicker than women do. Water. Incredibly important, yet a lot of people don't drink enough water, and then the whole thing about plastic water bottles versus a non-plastic. Plastic seeps estrogen into the bottle. Prevention of breast cancer. We talked a little bit about examination of the breast, and I think it's so important to understand that most tumors are found by the patient. And doing a proper examination. Part of our examination, when we examine patients, part of my examination, is to have the patient show them how to do a proper examination on themselves. Why don't I pull the chair up here, and then you can give me instructions here. You can be the, want to be the doctor or the patient? You be the doctor this time. Okay. You be the doctor.
When I examine the